a great introduction. You know, you always smile when you hear people talking about you, and you always feel a little chagrin because, like, who are they talking about? And then you go, oh, that's me. And I'd like to say thank you for making me feel welcome today. And I also like to say thank you to the staff and the volunteers of Vot-ER for inviting me to be part of this groundbreaking event. I know you're all looking forward to spending time during the next 2 days exploring ideas surrounding the intersection of health and civic engagement. This time will be both informative and activating. So, yes, I'm Dr. Deborah Turner, President of the National Board of the League of Women Voters of the United States. But I'd like to give you a few quick background facts that'll help kind of ground you in who I am. I was born and raised in a small town in northern Iowa, Mason City. For you musical enthusiasts, we are the River City of Meredith Willson's Music Man. So, in truth, I am a true corn fed kid, an Iowan, and quite frankly, proud of it. Contrary to popular belief, there are Black people from Iowa, and that is where my belief in civic engagement is rooted. I am pleased to join you today because I feel connected to this endeavor that you're about to embark on several fronts. First, I am a longtime voting rights activist, having grown up in a household where civic engagement was what you do. My mother set an example for us at an early age as I watched and helped her in everything from knocking doors to dropping literature. She was involved with the community issues, everything from fighting to start the very first breakfast feeding program funded by the city in our church basement to being appointed to the planning and zoning committee for our town. Now, if you know anything about small town America, the planning and zoning committee is one of the most coveted and powerful positions, and my mother well deserved it and did a great job. But at the heart of all her activities was voting. My mother, who refused to drive, made sure my father not only got himself and her to the polls on a regular basis, but was known for offering my father up to provide rides to others to the polls. In fact, one of his last requests at age 94 was making sure we got him to the polls to vote for the last president. Today, I am a healthcare provider. As a gynecologist who specializes in gynecology, I've spent 35 years practicing medicine rooted in civic engagement and promoting the intersection of democracy and healthcare. I truly believe healthcare and civic engagement share an important and critical relationship, and that those of us who are engaged in any aspect of the field must recognize the importance of this relationship and should be active in helping those we serve and those we serve with exercise their constitutional right to have a voice in our democracy. So bear with me as I take a moment to share with you some thoughts and ideas on this intersection of health and civic engagement. Let's start with a fundamental truth. A healthy democracy requires equal opportunity for all its people. The 2020 election was unlike any election we've ever seen. While the pandemic threatened voter participation, volunteer turnout and poll worker recruitment, it highlighted the urgent need for expansions to voting access that would give people more options to cast their ballots safely, securely, and fairly. Many states enacted provisions to make it easier to vote, both in person and by mail. Provisions like establishing notice and cure processes for mail ballots flagged for rejection, waiving witness requirements for mailed ballots, offering more early voting opportunities and sites, and expanding the absentee excuse to allow more voters to vote from home. However, these changes didn't happen automatically. Just as thousands of healthcare professionals pivoted from traditional systems of care to fight on the front lines against this novel and devastating virus, civic volunteers also pivoted and sprang into action to inform and protect voters in new ways. They mobilized registration drives and get out the vote campaigns online or in creative ways like car parades and transforming food trucks into mobile voter registration booths. Online voting tools like the League's Vote411.org resource became more vital than ever in keeping voters informed with up-to-minute alerts about important election changes. Election administrators worked around the clock to ensure that as many voters as possible would have access to the ballot. Our organization partnered with dozens of legal and civic groups to file lawsuits that would ensure safe access to the polls. It was an all hands in effort. Vot-ER was and is one of the novel and exciting actions that tapped into a group of voters most organizations had long ignored or struggled with how to reach: patients in healthcare environments, such as waiting rooms. But I will let Dr. Martin and all of his other great staff and volunteers share the success story of Vot-ER. Now I'm proud to say that all these actions paid off. The 2020 election saw the greatest voter participation in our nation's history, with the highest turnout rate in over 100 years in the most secure, let me say that again, in the most secure election we have ever held. This achievement made one thing very clear: increased voter access delivers increased voter participation. It took a pandemic, a public health crisis, to elevate the need for immediate change to our voting system and to prove that it could be done safely and securely. But we must not allow these expansions to be a one-time emergency exception. No, these voter protections must be our new norm. The voting provisions of 2020 were, to make an extremely relevant analogy, a shot in the arm for our democracy. But we need to fight to ensure that the immunity becomes part of our continued vigilance. Currently, state legislatures around the country are passing bills that not only undo the progress of 2020's voting expansions, but take us backwards and make voting more difficult than it has been in decades. It is not an exaggeration to call these new bills new Jim Crow laws. They are aimed at voters of color, income-sensitive voters, disabled voters, and women voters. Allow me to provide some history. The reason these laws can even be considered is because of a landmark Supreme Court case in 2013, Shelby County versus Holder. That decision rocked the civil rights world when it gutted important sections of the Voting Rights Act of 1965. The Voting Rights Act was one of the most important pieces of legislation of the 20th century. It was a cornerstone achievement of the civil rights movement that ensured that every American citizen, regardless of race or language, had equal access to the ballot box. But when this US Supreme Court removed a key federal oversight provision from that law, this became a full-on attack on the voting rights of all Americans. Following the Shelby County decision, dozens of states passed bills that made it more difficult for African Americans and other communities of color to access the ballot box. Bills that would have been scrutinized and many times prohibited by the oversight provisions of the previous Voting Rights Act. What we are seeing now from state legislatures is a continuation of this unchecked assault on voting rights, as most states consider harmful and often which can be deemed racially motivated laws to limit the right to vote. That is why we need a focus on civic health now more than ever. We're talking about preserving the soul of our very democracy, the right of all citizens to cast their ballot for the person, party, or issue of your own personal choice without undue barriers. Therefore, we need Congress to pass the John Lewis Voting Rights Advancement Act to restore the vital protections of the Voting Rights Act and ensure that all Americans have equal protection under the law. Likewise, instead of passing laws that take our voting rights backwards, we need bold democracy reform that makes it easier, not harder, to register and vote. We need to pass laws that reestablish public trust in our elections by increasing transparency, eliminating money in politics, and strengthening government ethics rules. We need to ensure fair representation for all Americans by eliminating partisan and racial gerrymandering. The good news is all of these reforms are included in one landmark piece of legislation, the For the People Act, which is before the Senate right now. The For the People Act is a huge step forward for voting access in this country, and it's exactly the kind of bold action we need to advance the civic health of our nation. Another crucial aspect of civic health that the pandemic threw into sharp relief was the power and spread of misinformation and disinformation. As healthcare providers and workers, we are all too familiar with the damage that distortions and outright untruths can do to public health, intentional and unintentional. The pandemic elevated some of the worst myths and disinformation around healthcare that many of us have ever seen. These untruths and distortions extended beyond the public health section into all aspects of the 2020 campaign season. This web of mis and disinformation, many times malicious and always harmful, flooded the discourse of the 2020 election, often stemming from or made worse by the confusion and fear of COVID-19. The League and our partners pushed back hard against the false information, equipping the public with trustworthy information like vote411.org and calling out bad information without spreading it further. We employed a strategy called inoculation messaging to saturate the public with honest information before the distortions and falsehoods could take hold. We knew we could not catch everything, but the unprecedented turnout of the 2020 election proved that mis and disinformation did not succeed in deterring voters from exercising their rights. However, it is not time to rest. Mis and disinformation continues to threaten our democracy. Misrepresentation of the election fuels voter suppression efforts, creating false narratives about the security of our elections in order to limit who can participate in our democracy. Now it is more important than ever to commit to spreading the truth that every American has the right to vote, that our elections are secure, and we must preserve and expand voter access to continue to build a democracy that works for all. That is the goal of the League of Women Voters and, yes, Vot-ER. And that's why we are in partnership. While none of this work is easy, together we are making progress in creating a more perfect democracy. I ask that you join us in this work. If you aren't already connected to your local League of Women Voters, check us out. Our grassroots volunteers are engaging their communities to provide reliable election information, register new voters, get out the vote in federal, state, and local elections, advocate for expanded voting access, and champion progress on vital issues like climate change, immigration, social justice, and healthcare. And of course, we are proud to partner with organizations like Vot-ER, which share our vision to empower voters and protect democracy. I would like to thank you all for your dedication to the improving the health of our nation, both medically and civically. I'm so grateful to count health providers as our allies in advancing democracy. It is our job, it is our duty, and it's something that we can all be very proud of. So thank you for letting me chat with you today. I sincerely hope that you have a great conference, and hopefully we'll spend some time chatting with a few of you a little later. So thank you, Dr. Martin, for a great, good welcome.
Thank you so much, Dr. Turner. And what a powerful, powerful way to kick this off. Thank you so much for grounding us in the importance of this work, but also giving us a real sense of where things are at in this country at the moment. And we're going to keep hitting on this theme throughout the next couple of days about the importance of where we are at. And as Dr. King said, the fierce urgency of now. I'm going to show you a little bit about the work that we've been able to do with incredible partners like the League of Women Voters and hundreds of other organizations, hospitals, clinics, health centers, to begin to build out the civic health movement. Many of you helped to create this civic health movement. Folks who are on this Zoom, it's your work, the incredible effort that you've put into this already that has made this successful. And for those of you who are new, welcome. We're excited to have you, and we need your help. Just to finish the last piece of Dr. Turner's opening, we're very excited to announce a partnership with the League of Women Voters, which is really aimed at igniting and activating healthcare providers throughout this entire country to be forces of good when it comes to voter registration and civic engagement. It represents the largest ever mobilization of healthcare providers for the purpose of civic engagement. And we are all just getting started. We cannot wait to do this work with you. I want to tell you a quick story about a patient that I had before I tell you about the Vot-ER work and the work of the civic health movement. I was an ER resident about 4 or 5 years ago, and I was taking care of a patient at Boston Children's Hospital. And this young woman came in. She might have been in her mid-20s. She had 2 kids with her, both younger than 3. And she said, "Doctor, I need your help. I just moved to Boston after escaping an abusive situation with an ex of mine. And about 5 months ago, I decided to move in here with an aunt in Boston. And everything was going well, except for the last 2 days. She and I have just been on the outs, and she kicked us out. She not only kicked me out, but she kicked the kids out as well." She said, "Last night it was so cold. It was a frigid February winter in Boston." And she said, "It was so cold that I couldn't do it to the kids again today. And so I didn't know where else to go. So I came here. Can you help me?" Now, for those of you who work in emergency departments, or those of you who are social workers, or those of you who are primary care doctors or community health center staff, you know this story. You know the story of having a patient who comes to you asking for help and feeling somewhat powerless because of how broken the system is upstream that led to her being there in the first place. But still, we do the best we can, right? So I called social work, which is what you do when you need problems like this figured out in the emergency department. And I said, we got this woman here. She's here with her 2 kids. And there's no way I'm sending her to the adult shelter. How can we help her? Social worker said, "Okay, no problem. Because Massachusetts is a right to shelter state, we can get her into transitional housing. She just has to give us a proof of residence that she lives in Massachusetts." So I go back to the patient. I say, "Okay, look, we're definitely going to help you, but let me ask you, do you have a check stub or a utility bill?" She said, "No, doc, as I told you, I just moved here about 5 months ago, so I don't have any proof of residence." I go back to the social worker. I said, "Look, she doesn't have proof of residence. What can we do?" He says, "Well, there's really nothing that we can do. But there is one thing." So what is that? He said, "We can register her to vote. Because if she registers to vote in the state of Massachusetts, that'll count as proof of residence in the state of Massachusetts." So I go back to the patient. I said, "Look, definitely going to help you. I just have a question for you. Do you want to register to vote?" This was her answer. "I didn't know I could." It's in her mid-20s. This is a woman who felt so out of our democratic process, so outside of it, that she didn't even understand the important constitutional right that she has to be part of our democratic process. And, she said, "Look, no one's ever asked me if I wanted to be registered to vote before." Well, when we look at the data, she is just one of 51 million people in this country who are not registered to vote. And when you ask folks who are not registered, "Why aren't you registered?" the vast majority of them, 60% of them, say, "No one has ever asked me before." And so for those of you who work in healthcare settings, you already understand this. You get this demographic overlap between patients who are really marginalized by our healthcare system, who are let down by our healthcare system, who the healthcare system fails on a repeated basis, are most vulnerable, and those who are not registered to vote in this country. They tend to be younger, poor, and are more likely to be people of color. And the mission of Vot-ER is to use those opportunities as a way to invite patients into the democratic process using trusted messengers like healthcare providers, like nurses, like social workers and physicians. We do that using 3 different tools: healthy democracy kits, like I showed you earlier. This is mine. Healthcare providers can use these kits to help their patients register to vote using that QR code or that text message code. 24,000 healthcare providers throughout the country have these kits and are using them on a daily basis to help their patients vote. Our site-based work is where we create posters and discharge paperwork and deploy those to hospitals. And then lastly, our digital work is where we work with community health centers to set up websites and text messaging campaigns so the community health center can reach out to their patients about the importance of voting. You're going to meet Dr. Stager tomorrow. She's wonderful. She's a pediatrician in Ohio who wears her Healthy Democracy kit, like you see there, every single day. She's just one of 24,000 healthcare providers who are doing this work on the front lines. Our demographic breakdown demonstrates that of the 24,000, about 60% are physicians, 23% are students, 10% are nurses and PAs, and 7% are social workers. And we're looking to grow in all of those capacities, and we'll need your help to get there over the course of the next year as we lead up to the 2022 midterms. When you ask our healthcare providers, why are you doing this? Why are you helping patients vote? The number one answer is they want to address social and racial inequities. You see, healthcare providers have to struggle with a healthcare system that doesn't work for the most vulnerable. And we are looking for an outlet, a way in which we can make things better, leave the system better than when we found it. And by helping people vote, healthcare providers are seeing that this is the most upstream way that you can go to address and impact the policies that impact our patients. Lauren is a 21-year-old patient of Dr. Stager's who was helped to register to vote for the first time in her life. Not only did she get registered to vote, she went home and helped her sisters and her family members register to vote for the first time as well. We know that we've helped just over 46,000 people like Lauren through Vot-ER in the 2020 election. When you ask the question of what were the folks like that we helped, about 50% of folks who were able to get a mail-in ballot from our process, about 50% of those folks were people of color. Over 60% were younger than 39. So what does this all mean? The people who we are helping tend to be more diverse and younger than the American electorate, which demonstrates healthcare as a really important way to offer, for many of these folks, the first offer, the first invitation to register to vote and to be part of the democratic process. And then last story I want to tell you is about Masa. She's a medical student at Duke. She was a team captain, and she led her small team of medical students out to do voter registration missions like this at the Bethel AME Church, which is a Black church in Raleigh, North Carolina, helping folks get registered to vote at a COVID drive-through screening clinic. Through our partnership with Men Out the Vote, which we're very proud of, we helped 80 medical school teams get established and do this important work of registering folks to vote and getting them ready for the 2020 election. The medical students alone accounted for nearly a third of all of the work and the impact of Vot-ER. And so in summary, we helped just over 46,000 people with voter registration and mail-in ballot process. 70%, nearly 70% of those folks voted. In terms of the folks who got their voter registration done or got their mail-in ballot done, nearly 70% of them actually voted. Very important. 24,000 healthcare providers got these kits and helped their own patients vote. And about 700 sites throughout the country use Vot-ER in some way. The most important thing that we're doing in the next couple of months, the next year, as we lead up to 2022, is really leaning into the culture changing work with our partnering associations and medical organizations. We have incredible partners like the American Academy of Pediatrics. For their 67,000 pediatricians, if they want to get involved in advocacy, one of the first options they have is to get engaged with Vot-ER. Or like the American Medical Student Association, who just had their national conference. For their 30,000 medical students, they get a Vot-ER Healthy Democracy Kit to help make sure their patients, their colleagues, their friends are all registered to vote. Or like Voting is Social Work, one of our proudest partnerships. Over 20 social work organizations and dozens of schools have been mobilized to do this work of voter registration in coordination with this incredible organization. And it's not just organizations, it's hospitals as well. CEOs across this country have sent out messages like the following here, helping to promote voter registration and promote the importance of civic engagement in healthcare. Look, where we're going is there are 53,000 non-urgent healthcare sites throughout this entire country. We want to be in every single one of them. We want voter registration and civic engagement to be part of every single one, and we're at about 1% of the way there. To get there, we have to build power longitudinally, and it's not just like traditional campaigns. We can't just mobilize people and let them go after the election. We have to do this work of organizing in between national elections, and that's why we're all here together. That's what we're doing now, building capacity, building power. The Vot-ER Civic Health Fellowship is a 10-month-long longitudinal community organizing training program that seeks to do just that. We've got several of our fellows here today. Very excited for that. 90 fellows throughout the country, high potential healthcare folks who are community organizers in spirit, but we're going to give them really the tools, the tactics, and the network to take their skills to the next level. And we're going to activate them in the 2022 midterms to really take it to the next level in terms of their impact. It's not just about individuals, though. We need to continue doing the organizing and mobilizing work for organizations as well. National Civic Health Month is one of the most important ways that we do that. We have over 150 organizations, health centers, hospitals that have all committed to take at least one action in the month of August to promote civic engagement, and we want your organization to be involved with that. It's as simple as doing something like this, sending an email out to your staff about voter registration. There are many, many other ways to get involved. And so the sun is rising on this work. Physicians are waking up, medical students are waking up, nurses are waking up, social workers, healthcare providers throughout this country are waking up to their potential to fundamentally alter the relationship between health and civic engagement in this country. And we need you to be a part of that. Your organizations, we'd love you to be part of Civic Health Month. And if you're a healthcare provider, please get your Healthy Democracy Kit and help your patients and your colleagues register to vote. That's all I got for you guys.